Hello, everyone. Welcome again to my channel. If today is the very first time that you are tuning in, my name is Janje. I am a registered nurse, and this is Health Talk with Janje. Now, again, as said for my previous video, if you are wondering about my background and how it relates to healthcare or this topic, I just want to encourage you to watch my introduction video just to get a little bit more insight into my background, my education, my career and my professional experience. Just to recap, the purpose of this channel is just to create awareness. Pretty much each week I tackle topics and then try to address some questions and concerns to clear up myths and misconceptions about healthcare within the African community and whoever may find this information useful. Um, so that being said, I just want to recap a little bit from the topic that I discussed last week. So last week I talked about the topic was should I be afraid of my doctor? And then during that discussion, I discussed some reasons why people tend to be afraid and how this fear can affect the outcome of your visit with the doctor. I shared some tips that you can use to help yourself. And then I concluded by saying that no, you should not be afraid of your doctor. So basically, a doctor is your healthcare partner, okay, and it's there to help you. But for this partnership to be effective, there needs to be honesty, there needs to be good communication, there needs to be collaboration, and there needs to be transparency. So that being said, the topic I will be discussing today is how do I tell the doctor my symptoms? Now, this is something that many people struggle with, and it is very important that you are able to tell or communicate your symptoms clearly to the doctor. Pretty much, you need to be able to explain to the doctor what is wrong with you, what symptoms you are having, and what you are experiencing. Now, if you can remember, I said earlier that your doctor is your healthcare partner. So effective and good communication is very important for this partnership to be fruitful or for this partnership to be beneficial to you and everyone on the team. So for those of us that are of the Christian faith, when we look in the Bible in the book of Amos chapter 3 verse 3, the scripture says, do two walk together unless they agree to meet. So in order for the partnership between you and your doctor to work, you need to be able to walk or work together with your doctor. And this starts with effective communication, telling your doctor clearly what is wrong with you. Whether your stomach hurting, your back hurting, you having chest pain, you vomiting, you confused in the morning, or you waking up dizzy, or you shaky. You need to be able to communicate those symptoms clearly with your doctor. So for the discussion today, objectives or areas I'm going to be focusing on is why is this important? Why is it important to be able to clearly explain your symptoms to the doctor? Then I'm going to be giving a list of general questions that your doctor may ask you during your visit. And then I'm going to be sharing some tips on how to prepare for the visit. And then I'm going to be talking about how to communicate your symptoms with the doctor. And then I'm going to be concluding this topic for today. Okay, so why is this important? So when you are able to communicate clearly about your symptoms, your health issues or concerns, your doctor will be able to understand and get a clear picture of your mental, your emotional, and your physical state of well-being. Now, for those of you who may not have a clear understanding of what symptoms is, when you hear me say symptoms, it's pretty much, it's simply the things that you are experiencing as a result of an illness, or, maybe if something is wrong in your body or your body internally is not working the way it's supposed to be, then you start having symptoms. When you have an illness that's going on that you may or may not be aware of. Now, example of symptoms could be pain, it could be fever, it could be weight loss or weight gain, it can be extreme tiredness, it can be loss of taste and so forth, it can be coughing, it can be stomach pain, it can be diarrhea. So those are some examples of symptoms. So when you think about it, who knows you more than yourself? Who can better explain the changes that are going on in your body, in your mind, and in your heart more than you? So remember the common saying that we have, that no one will know how tight a shoe is that you are wearing unless only you can know how tight a shoe is on your foot that you are wearing. So unless you tell the person that, oh, this shoes I'm wearing is so tight on my feet, the other person will never know how tight that shoe is. That person can only speculate or they can guess, maybe based on your facial expression or how you may be walking in the shoes. But when you start describing exactly how tight that shoe is, like, this shoe is so tight on my feet, my toes are squished together, I can't even straighten my toes out, it's bent, I feel like I'm getting sore on my little toes. It's hurting my back. I can't even stand. I'm not even able to walk in it. Until you start describing your symptoms in detail, that's the only time the other person may be able to give you some suggestions or recommendation on what to do to help relieve that tightness from your feet. Like, okay, so how about you sit down? How about you take the shoes off for a little bit? How about you? Do you want a pair of flip-flops that you can use in the meantime? So until then, a person can only speculate or guess what is going on. So this is the same concept when it comes to your health and being able to clearly communicate your symptoms with your doctor. This is the same concept when it comes to being able to participate in your health plan, basically being a partner in your healthcare. And in that case, you are the leader of that team. Also, this is another reason why this is so important is because it allows you to be a participating member of your healthcare team. Okay? And then it points the doctor in the right direction. So, being able to clearly tell your doctor your symptoms, it can point the doctor in the right direction. It can help your doctor to be able to identify your problem or to be able to tell you, oh, what is really wrong with you. So the outcome of your visit is based on how well you lead your team, how well you lead the healthcare team. Meaning, if you communicate your symptoms clearly with your doctor, he or she will be in a position to decide on the right testing that to send you for to make the right in order to make the right diagnosis or to be able to tell you exactly what is wrong with you and then to come up with the best treatment plan that will work for you. Okay, so here you are. Your symptoms have become unbearable, or your symptoms have gotten to the point where you can no longer tolerate it. Or, well, I hope you will get to the doctor quicker before reaching to the point where you can no longer tolerate your symptoms or where it has become unbearable. But whatever the case may be, going in to see the doctor, you decide to call and schedule an appointment. It's important to have an idea of certain questions that the doctor would typically ask you for. So some questions that you can expect your doctor will ask is, what are your symptoms, or maybe what brings you in to see us today? And then what is the onset of your symptoms? Meaning, when did these symptoms start? Did they start a week ago, 2 days ago, 3 days ago, 3 months ago? So the onset of your symptoms. How long do your symptoms last when it comes on? How long does it last? Does it last all day? Or does it last for like maybe a few hours? And then what triggers the symptoms? The certain activity triggers your symptoms. Like, is it triggered by laying down? Is it triggered by doing activities around? Is it triggered by walking? Is it triggered by going up the stairs, coming down the stairs? So what triggers your symptoms? Also, are your symptoms constant or are they intermittent? So are they constant, meaning does it don't go away? So once your symptom starts, it just stays on and on and on. And then intermittent simply means it comes and goes. So it comes, it lasts for a few minutes, then it goes away. Another question you can expect to be asked is, what makes your symptom worse or better? Does certain things make it worse? Like maybe walking makes it worse, or standing on your feet too long makes it worse, and what causes to be it does is there anything that can cause it or make it feel better? Like maybe if you lay down, does it feel better? Or if you cough, does it make it worse? Or if you take deep breath, does it make it worse? So and then another question you can expect to be asked is, have your symptoms worsened since it started, since the onset of your symptom? Has it worsened or has it gotten better? Or did it get worse or it got really bad since it started? It's getting bad, it's not improving, or is it getting better? And then another question that you may be asked is, are your symptoms affecting your ability to perform your everyday activity? Is your Does your symptoms make it hard for you to bathe yourself? Does it make it hard for you to walk? Does it make it hard for you to cook? Does it make it hard for you to clean up around your house? So how are these symptoms affecting your day-to-day activities? Okay, so on this slide, I listed three tips on how to prepare for your visit. So first and foremost is to not be scared. Don't be scared of your doctor. Remember, your doctor is your healthcare partner. Your doctor is your friend. He or she is there to help you. Okay. Next, you want to keep a written diary or mental note. Make a mental note about all your symptoms that you are having. So you can do this by trying to answer the general questions that I listed in the previous slide. And that can, be a list that you can go off of. And then lastly, you want to make a list of all the medication that you are taking. If you don't have a written list of all your medication, it's okay to take all the medicine bottles that you have at home that you currently take with you to the doctor visit. And remember, all your medication that includes any vitamins that you may be taking, any medicine you bought over the counter that you take, every now and then, like Tylenol or Motrin. That includes any herbal medication that you may be taking, even if it was sent to you from back home or it was given to you by a friend or family member. So any supplement, like any vitamin supplements that you are taking, those should all be included in the medication on your medication list, or those are all part of the medications that you take if you are taking any of them. Okay, and then also it's important to know that you want to also be aware of your allergies and to share that with your doctor because that can be very important as well. Okay, so we have come to the most important question: how to communicate your symptoms to the doctor. So we're gonna use be, share, and tell. So firstly, you want to be honest and open with your doctor. Tell your doctor everything that is bothering you because your doctor needs to know how you are feeling. Nothing is too small. Let the doctor determine if it is relevant or not, or let the doctor decide if it's important or not. Don't think that, oh, if I tell the doctor this one, the doctor may think I'm crazy, or oh, this one is too embarrassing. I don't want to share it with anybody. Remember, it's just you and your doctor in there, and your doctor needs to know this information in order to be able to help you. Then you want to share any lifestyle habits that you have. Okay, be open and share those habits, like your eating habits, your sleeping pattern, if you smoke or if you drink alcohol. Those are things that are important because sometimes when you drink alcohol and you're taking prescription medication, it can affect either the strength of the medication that you are taking. It can make it either too strong or too weak, or it can make the side effects of that medication more pronounced. So sharing your lifestyle habit with your doctor is very important. And then lastly, you want to tell the doctor about any concerns that you may have or any major life changes that you may be experiencing. And maybe there was a death in the family, or you've been under some type of stress, whether it be from divorce or with your family with childcare issue or with children, because all of this can sometimes be medically useful. So the doctor can use some of this information to help make the right diagnosis for you and be able to come up with the right treatment plan for you. Okay, so this brings us to the conclusion of this topic. So to conclude, the outcome of your visit is based on how well you communicate your symptoms with your doctor. Okay, again, you want to be honest and open with the doctor. be honest with giving the information that the doctor will need to help come up with the right treatment plan that will be better for you. This will help your doctor to understand what is happening to you or your medical condition fully, and the doctor will be able to recommend the best treatment choices that will help alleviate your symptoms and that will help make you feel better. Thank you so much for watching. I hope this was helpful. And if you have any comment, questions, or if there's something that you aren't still sure of or something that you need clarification on, please feel free to leave a comment in the comment section. If you like what you heard, please subscribe to my channel, like, and most importantly, share the video with your family, friends, and loved ones. Again, I want to thank you so much. Bye for now until we meet again. Bye.